So, have you ever actually stopped to wonder how your brain communicates with, well, your face, or your eyes, or even your heart? I mean, how exactly does a tiny thought inside your head instantly translate into a smile, a quick blink, or even digesting your lunch? Well, today we are tackling exactly that as we explore the incredible biological wiring of the human body. Welcome to our latest explainer, where we decode complex medical topics so you can master them with absolute ease. And today's primary focus? Cranial nerves explained.
I'm honestly so excited to guide you through this. We're going to take dense textbook anatomy and completely transform it into a super simple, beginner-friendly top-down highway of the 12 cranial nerves. Seriously, whether you're a med student pulling an all-nighter or just someone curious about human anatomy, this explainer is designed to make these pathways incredibly clear, practical, and most importantly, actually memorable.
All right, let's dive right into this overview. When you look underneath the brain, you'll spot the origins of these 12 pairs of cranial nerves. And notice how almost all of these peripheral nerves emerge straight out of the brainstem. You can kind of think of the brainstem as your body's main server room, right? And these 12 nerve pairs, they're basically thick bundles of biological fiber optic cables. They provide all the essential wiring for the anatomical structures in your head, your neck, and eventually down into your torso. Now, before we cruise down this anatomical highway, let's quickly demystify some of the jargon you're definitely going to run into. Basically, nerves carry traffic, but the direction actually matters a lot. Efferent nerves act as your motor cables. They carry signals out from the brain to the body to create an action, like moving a muscle. On the flip side, afferent nerves act as sensory cables, bringing feeling and sensory info from the outside world back into the brain. Oh, and as we'll see, some nerves are mixed, meaning they handle a two-way flow of both motor and sensory traffic. Section 2. Brain exits and pathways. Here's where it gets really interesting. Trying to memorize the exact sequence of the 12 cranial nerves can feel completely daunting, I know. But medical students have actually used this incredibly practical mnemonic for generations, and it goes like this. O, to touch and feel very good velvet, ah. Every first letter perfectly corresponds to a nerve. Olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, accessory, and hypoglossal. Seriously, keep this little trick in your back pocket. So, how do these cables actually get out? Well, these nerves have to leave the heavily armored skull through tiny little holes and crevices in the cranial base, which are called foramina and fissures. It's kind of like threading wires through drywall. For example, the optic nerve uses the optic canal to get out, while the nerves that govern your eye movements have to squeeze through a tiny slit called the superior orbital fissure. Along their journey, several of these cranial nerves pass straight through something called the cavernous sinus. Think of this as a major junction box. It's an irregular cavity formed inside the dura mater right on either side of the sphenoid bone. Essentially, it's a large pool of venous blood that drains the cranial cavity. And because multiple critical nerves travel right through this exact spot, an infection here is a big deal because it can knock out several different nerve functions all at once. Section 3. The senses and eyes. Let's compare cranial nerves 3 and 4. First up is the oculomotor nerve. It's a mixed nerve packed with motor and parasympathetic fibers. If this particular nerve gets damaged, a patient might actually show up with a severely dilated pupil. Then you have the trochlear nerve. This one is wild. It has the longest intracranial pathway, but it's the absolute thinnest of all the cranial nerves. It powers just one single eye muscle, the superior oblique. A clinical injury here is super fascinating because the patient will specifically experience double vision, but only when they try to look downward. Now, this next part is often completely misunderstood. The abducens nerve, or cranial nerve 6, might seem small, but it plays a massive role in pulling your eye outward, away from your nose. This is an action called abduction, using the lateral rectus muscle. If someone suffers an injury to the abducens nerve, the eye gets pulled inward by opposing muscles that are no longer being balanced out. This leads to convergent strabismus, or what we commonly call being cross-eyed. Section 4. The face and jaw. Everyone, meet the absolute heavyweight of the cranial nerves, the trigeminal nerve, cranial nerve 5. The prefix tri refers to its three massive divisions. You've got V1, the ophthalmic nerve, V2, the maxillary nerve, and V3, the mandibular nerve. It is a wildly important mixed nerve. It provides the sensory feeling for your entire face, and its motor fibers actually power your muscles of mastication, which basically means you literally couldn't chew your favorite food without it.
These three branches perfectly map out onto the human skull in an intricate branching network. V1 handles the forehead and the eyes, V2 covers your cheeks and nasal cavity, and V3 stretches all the way down to your jaw and oral cavity. So anytime you feel a crisp, cold breeze on your cheek or the awful pain of a toothache, it's this exact trigeminal network firing those signals straight back to your brain. And right below that is the facial nerve, cranial nerve 7. Now, while the trigeminal nerve feels the face, the facial nerve actually moves the face. It's an incredibly versatile mixed nerve. It controls all the muscles of facial expression, everything from raising your eyebrows in total surprise to cracking a huge smile. But it doesn't stop there. It also manages saliva from your salivary glands, tears from your lacrimal glands, and even carries special sensory fibers so you can taste food on the front 2/3 of your tongue. Talk about a multitasker, right? Section 5, Hearing and the Vagus. Enter the vestibulocochlear nerve, cranial nerve 8. I love to think of this nerve as a highly advanced two-way audio and motion sensor. It is entirely sensory and splits into two distinct parts. The cochlear division hooks up to your spiral-shaped cochlea, handling absolutely everything you hear. Meanwhile, the vestibular division attaches to your semicircular canals. This part acts as your internal gyroscope, constantly managing your spatial balance and sensing motion. Now here's where our journey takes a massive turn. Meet the vagus nerve, cranial nerve 10. The word vagus actually translates from Latin to mean the wanderer. And wow, does it ever live up to its name? It is literally the only cranial nerve that leaves the confines of the head and neck, wandering far, far down into the thorax and abdomen through this incredibly long, descending pathway. So what exactly does this wanderer do? Well, the vagus nerve is the ultimate master of your body's rest and digest parasympathetic system. It provides a crucial motor supply to the smooth muscles in your gastrointestinal tract, just to keep your digestion moving along smoothly. But even more importantly, it directly regulates your heart rhythm. It also supplies sensory and motor fibers to your larynx and pharynx, meaning it's the very reason your airway is protected and you have the ability to vocalize. Section 6, Neck and Tongue Muscles. To cap off our list, we reach the hypoglossal nerve, cranial nerve 12. Unlike the mixed nerves we just talked about, the hypoglossal is purely a motor cable. Its sole dedication in life is moving the intrinsic and extrinsic muscles of your tongue. Every single time you articulate a word in speech or push a bite of food to the back of your throat to swallow, you are firing this exact nerve pathway located just beneath your jaw. All right, let's wrap up this explainer by summarizing our key takeaways for today. First up, your brain communicates with the world via 12 pairs of biological cables, functioning as efferent motor and afferent sensory highways. Second, if you ever feel lost, just remember the OOO mnemonic to quickly recall the exact sequence of the nerves. And third, never ever forget the wandering vagus nerve, the one remarkable exception that literally leaves the skull to manage your heart and gut. See? Cranial nerve anatomy definitely doesn't have to be overwhelmingly complex. Which leaves us with a final, really interesting thought to ponder. Knowing what you know now about these incredible highways, how might a tiny bit of inflammation or damage to these specific nerves explain everyday symptoms you've probably experienced? Things like sudden dizziness, unexplained dry eyes, or even a sudden loss of taste? The biological wiring of the human body is truly a masterpiece. Hey, if you found this breakdown helpful and you want to master even more topics, be sure to subscribe for more simple, beginner-friendly medical explainers. Keep learning, keep focusing, and I will see you in the next one.